Hey everyone, it's Jack Dengermond. Today I'll be presenting on my vaccine passport public engagement strategy that was developed for PIT 504 public engagement strategies. So this is my final design canvas, but I won't be dwelling on this since I'll be discussing each component later in the presentation. But first of all, the topic of my public engagement strategy is vaccine passports. I've had a few people recommend using a different term such as vaccine card, certificate, or verification, since there's a certain association that people have with the term passport. But for the purpose of this presentation, I'll be using the term vaccine passports. Please know that I'm referring to all of these things and that a different term may be more appropriate when engaging the public. So, vaccine passports are a way to provide proof of COVID-19 vaccination and are sold as a tool to bring people back to more normal activities. Over the past 7 weeks of this course, vaccine passports have become an increasingly partisan and controversial issue, at least within the United States. So, due to the controversial nature of vaccine passports, I found that it would be important to design a public engagement activity that allows for deeper, multi-directional dialogue. And in describing this public engagement event, I will be using the term community consultation, which is kind of an alternative to a citizens' assembly that is more welcoming to all community members. I'll be going into more detail about what this community consultation consists of near the end of the presentation. So, who is the target public audience? Well, this would be residents of El Paso County, Colorado, and basically the goal would be to get a demographically representative subset of this population to participate in the community consultation. So, the visual on the right shows the racial and ethnic makeup of El Paso County, although it will be important to consider other factors such as the area's unusually large military presence. It's also important to note that visitors to the region will be impacted by vaccine passports, and while they will not be directly represented, it will be important to include residents who rely on tourism as participants, since that is the county's third largest economic driver. So, the main value provided to the public is that the community consultation offers the public a voice in the governance of vaccine passports. They have the potential to offer economic, social, and public health benefits, but there are also risks and concerns that needs to be addressed. So by participating, the public will help the health department make more informed decisions about how to better implement vaccine passports. Members of the public who participate will also get the opportunity to learn from experts in public health, law, and economics, as well as to hear from community members with diverse backgrounds and perspectives. So the primary target decision maker is El Paso County Public Health, although the outcomes from these community consultation could be useful to other local health authorities and private sector entities. So El Paso County Public Health will benefit from increased credibility by using outcomes of the community consultation to inform its governments of vaccine passports. If the efforts to incorporate public perspectives are made genuinely, transparently, and in good faith, the risk of public backlash about a decision may be minimized. It's also more likely that the health department will be able to implement vaccine passports in a way that is better for the community, such as being more inclusive, considering relevant exemptions, maximizing the benefits while also addressing concerns. So, through an earlier project about vaccine eligibility for PIT 502, I was in touch with El Paso County Public Health Office. But unfortunately, when I tried leveraging this existing relationship for this class, the office was unresponsive. So, before moving forward with plans for the community consultation, I would need to have a conversation with the health department because it has been difficult to design a public engagement strategy with no direct input from the target decision maker. And while El Paso County Public Health will have broad decision making power about vaccine passports, private sector entities will likely end up making decisions about how to actually interface with them. So, I interviewed someone who owns and operates a retail franchise, as well as a receptionist at a law firm, both in El Paso County. Both of these individuals will have decision making power and sole responsibility for enforcement regarding vaccine passports. And while it was helpful to talk to these decision makers, I will need to build relationships with local groups, such as the Pikes Peak chapter of the Colorado Restaurant Association or the Pikes Peak Small Business Development Center. And by engaging with such groups, individual decision makers and stakeholders can be collectively represented, and dissemination of information will also be greatly simplified. So, ideally, since El Paso County Public Health is the primary decision maker, I would be in direct contact with them. And if this were possible, channels for communication would then be direct by phone, email, video conference, or even in person where it is safe to do so. I'd also want to connect with industry groups to leverage their existing relationships with private sector decision makers, as I talked about on the last slide. And in addition to this, I'll want to build relationships with advocacy groups to help recruit stakeholders and demographically representative group of participants. Dissemination of the results will occur through local news outlets such as the Gazette and KRDO News Channel 13. Key partners, of course, include El Paso County Public Health, which will help to set the parameters, co-design the community consultation, and provide expertise on the local government. Industry groups will offer insight into business needs as well as connections to key stakeholders. Advocacy groups will help to represent a specific group's concerns and provide trustworthy connections to potential participants. And experts, of course, will provide knowledge to help develop the engagement materials and also give presentations at the community consultation itself. So some notable resources include strong ties to El Paso County policymakers through the Public Health Department, as well as access to people with relevant expertise. Vaccine passports also benefit from being a high interest topic, which will make it easier to recruit participants and disseminate results. So for expertise on the actual process of public engagement itself, I will be relying on people that I've met through the PIT program, such as Mahmoud, as well as the Consortium for Science and Policy Outcomes, and Arizona State University more broadly. As far as the actual event itself, well, prior to the event, there will need to be a lot of work consulting with experts, stakeholders, and decision makers to develop materials and recruit participants for the engagement event. The actual consultation activity will aim to engage 50 to 100 representative residents of El Paso County through multiple sessions over a one-day period. These sessions will include general background information on vaccine passports, as well as 3 discussion topics on governance, privacy, and equity/accessibility, each with their own mini presentation and facilitated roundtable discussion. So the community consultation will take place over video conferencing software, and roundtable discussions will take place in smaller breakout rooms of 5 to 8 people. And then, of course, after the event, work will need to be done to compile and disseminate the results. So the total cost is estimated to be a little bit over $30,000, which will be funded through state and federal grants, as well as El Paso County taxpayer dollars. And we will also seek private sector sponsorships where possible. In order to assess the outcomes of the consultation, I will be looking at a few different data points. The first is the number and diversity of participants, which will be measured through a demographic survey preceding the engagement activity. Another assessment is the credibility of the process and outcomes, which will be analyzed qualitatively through public opinion. Third will be determining if outcomes from the forum both benefit the public and address the public's concerns, which will again be measured through public reaction. And a final assessment will be measuring what the public, experts, stakeholders, and decision makers have learned from each other, which will be accomplished through a follow-up questionnaire. So thank you so much for listening to this presentation and for all of the wonderful feedback that I've gotten this semester. I look forward to comments and questions in the discussion post. Thank you once again.